Welcome. Today we will explore on planning a successful health awareness campaign, a step-by-step guide. Health awareness campaigns play a crucial role in educating communities, promoting healthy lifestyles, and preventing diseases. Whether targeting local neighborhoods, schools, or broader populations, a well-structured campaign can create meaningful and lasting impact. Planning such a campaign requires careful consideration, clear objectives, and strategic execution. By following a step-by-step approach, organizers can maximize engagement, ensure accurate information dissemination, and foster positive behavioral changes. The first step in planning a health awareness campaign is defining the objectives. It is essential to identify what the campaign aims to achieve, such as increasing knowledge about a specific disease, promoting vaccination, encouraging physical activity, or reducing unhealthy habits. Clear objectives help guide the campaign's content, target audience, and methods of delivery. For instance, a campaign aimed at preventing diabetes may focus on healthy eating, regular exercise, and early screening awareness. Next, understanding the target audience is critical. Organizers must consider factors such as age, cultural background, education level, and health literacy. Tailoring the campaign to meet the audience's needs ensures that messages are relevant, understandable, and actionable. For example, educational materials for teenagers may use interactive social media content, while materials for older adults might rely on printed brochures and community workshops. The third step involves creating engaging and accurate content. Health messages must be evidence-based, easy to understand, and visually appealing. Using infographics, videos, and real-life stories can make the information more relatable and memorable. It is also important to include practical advice, such as tips for healthy eating, exercise routines, or signs and symptoms that require medical attention. Collaboration with health professionals ensures the accuracy and credibility of the content. Once content is prepared, the choice of communication channels becomes essential. A successful campaign uses multiple platforms to reach a wider audience. Social media, local newspapers, radio, TV, community centers, and schools can all be effective channels depending on the target population. Interactive activities like workshops, health fairs, and free screening events further enhance engagement and provide hands-on learning experiences. Planning logistics and resources is the next step. This includes arranging venues, scheduling events, coordinating volunteers, and securing necessary materials. Budgeting and sponsorship may also be necessary, especially for larger campaigns. Efficient logistics ensure that the campaign runs smoothly and reaches the intended audience effectively. Finally, monitoring and evaluating the campaign's impact is crucial for continuous improvement. Surveys, feedback forms, and participation statistics help measure the effectiveness of the campaign and identify areas for improvement. Tracking behavioral changes and health outcomes over time provides valuable insights for future initiatives. In conclusion, a successful health awareness campaign combines clear objectives, targeted messaging, engaging content, effective communication channels, careful planning, and systematic evaluation. By following these steps, organizers can educate communities, inspire healthier lifestyles, and create a positive and lasting impact on public health. Thank you for your patience hearing.